Thank you. Thank you to Manos for your invitation. It's a very nice course. I would like to speak about arthroscopic Latarjet with a posterior guide and 2 screws. Operating position in the bed chair. There is a different portal. 2 portals posteriorly for the guide and 5 portals anteriorly. The third step after you prepare the glenoid side is the preparation of the coracoid process. Is very important step because you can make some mistake when you drill the glenoid side, and it's very important to release the coracohumeral ligament and to prepare very well this part. And after, it's very important to make a good subscapularis split. I use a switching stick from back to front with the conjoint tendon in place to be safe and secure regarding the nerve. You move the switching stick from back, and after that, you move laterally the switching stick to be more laterally in anterior part. And after the split of the subscapularis, you can prepare with the same guide, use Manos actually. You can make 2 tunnels from back to front. You see on the sawbone the technique with the guide, and you have in parallel in live, you see, and you can drill 2 holes to make 2 tunnels parallel to the cartilage to be safe and regarding the nerve, because if you have 2 obliquity of the 2 screws, you can damage the suprascapular nerve. Here is a lateral view. We have prepared with the rasp the glenoid neck. It's a revision of Bankart to just remove the suture. And after that, you can prepare very well the anterior part of the glenoid neck, and after you push the switching stick from back to front, laterally to the conjoint tendon, and you can make the split of the subscapularis with a radiofrequency device. You can move your scope more anteriorly if you have any problem to visualize the glenoid side. And here you see the glenoid from the through the split, and you can finish the preparation of the inferior part of the glenoid. And after that, you introduce the guide from back to front. You see, you can manage very well the positioning in cranial to caudal and to lateral to medial. And you drill 2 holes. You remove the two drill, and you introduce 2 K-wire. And after that, you pass the 2 K-wire through the split of the subscapularis. And you start to prepare with the rasp the inferior part of the coracoid process. It's a key point because you need to have any spike on any deformity of the coracoid process to be safe and to be sure to have very good contact between the glenoid bone and the coracoid bone. You cut the coracoid process like this, and after you see the 2 K-wires inferiorly to lock the part of the coracoid. You introduce a long screw in the inferior part of the coracoid, and you introduce the long screw, the K-wire into the long screw, and it fixes the coracoid, and you can finish to prepare the coracoid with the rasp. After that, you push 2 screws, and the inferior screws go directly along of the K-wire to the glenoid bone, and you can screw in, and you see the coracoid process get to the glenoid neck with a good compression. To be safe regarding the very strong screw, I use a Di Giacomo plate, and after you can check the aspect of the coracoid process, and if you have overhanging, you can remove a piece of bone with a rasp. Normally with a guide, you have the good offset for the coracoid process and for the glenoid side too. And after that, you can see it's flush, no overhanging, and it's good to continue. And you see here is a very interesting draw from Burkhardt and Lederman. You see if you modify the orientation of the screw, you can damage the suprascapular nerve just on the spinoglenoid notch. And it's locked sometimes by a ligament, and it's very important to be safe, to don't damage it, because the result is definitively worse. And you can see the postoperative X-ray with a good positioning of the two screws. You see here, and you see the CT scan 2 years after the procedure. On the aspect in 3D, and you can the result of one mountain guide. I repair simultaneously in the same time cuff tear and instability with the Arthro Latarjet and cuff repair. You see the biceps is with the biceps tenodesis and with this very small Popeye sign on the left side. And you see the final result of this patient. Shoulders seems stable anymore. Thank you so much for your attention.